the strength section, I missed a few components. So for the body weight of push-up, the targeted joints of the push-up are your shoulders, your elbows and your wrists, which uses your core muscles. You minimize movement to our hips and spine joints and keep your torso and your legs in a straight line. When you move your shoulders through the transverse extension and the transverse flexion, the transverse extension is when you move your arms away from your chest, and the transverse flexion is when you bring your arms towards your chest. The two bicep muscles being used are the brachials and the bicep brachii. Both work together with a inner muscle in your forearm to complete this motion. For the bent over arm rows, the main muscles used during bent over arm rows is the middle and the lower trapezius, the rhomboids, the latissimus dorsi, the tres major, and the posterior deltoid, the infraspinatus, and the teres minor. The main focus in a bent over arm row is to generally work your back. The back muscles will work together to complete this exercise. A weighted lunge. The lunge is a lower back exercise that works heaps of muscles at once, being the glutes in your hips and butt, with the hamstrings and quadriceps in your thighs. The calf muscles in your lower legs, your abdominal muscles, and your back muscles act as a stabilizer during this exercise. For the cardio endurance, for the treadmill and the cycling, I didn't praise my client enough. So during the session, when you are training a client, some of the things that you can say is, you're doing a great job. Watch their posture to make sure that their posture is correct. If they're not using the correct technique, you can say things like, keep your back straighter, push harder, or something like that to keep them focused on the job, basically. So yeah, when you are training a client, you've got to make sure that you are using a lot of cues and a lot of praise while you are training. For the special populations, for high blood pressure is a condition which the force of the blood against the artery walls is too high. This can lead to heart disease and a stroke. To avoid getting high blood pressure, it's really important to maintain a healthy weight, to keep a healthy diet, to exercise regularly, limit the alcohol, limit the salt intake, monitor your blood pressure. If the condition is starting to worsen during any of our training sessions, you may need to refer the client to see a doctor or an allied health professional to make sure that when you are training a client that does have high blood pressure, to make sure that it is completely safe. Training someone with a knee injury, that could be occurred from a fracture, a dislocation, an ACL damage, which is the anterior cruciate ligament, the PCL, which is the posterior cruciate ligament, injuries, meniscus tears, tendon tears. Exercise can help to strengthen the knee. Post-operation, post-injury, beforehand the client will need to get a referral though prior to commencing training. If injury gets worse or the pain increases, refer a client back to an allied health professional. With a knee injury, you've got to start with the weight, with very light weight, and then increase the weight over time. You do not want to start with a real heavy weight with a client that's just had a knee injury or knee operation. You could actually do worse, could damage the knee worse than what it was to begin with. So start with light weights and then increase. With back injuries like scoliosis, in my training session that I had, my client actually did have scoliosis. So we were just a bit careful with a few things. With any back injury, that could be occurred from doing a sudden movement and jolting your back. Any injury that can often happen can be a strain or a sprain. With a back injury, start with either a light weight and then increase it up a little bit higher to help build up the muscles again. And apply weights over time. With a back injury, you can't rush the healing process, or you can sustain either a different injury or you can worsen the injury as well. Thank you very much. I hope I've covered everything.